Welcome to today's episode. Today we're going to be talking a little bit about peptides. I'm joined today by my daughter, Katie, who has learned about medicine all throughout her life and has delved into medicine herself, more a holistic type of medicine with Ayurveda, with her hypnotherapy practice, with her behavioral therapy education, and also her metaphysics background.
I know it's a
So
lot to remember.
I know it's a lot. But the thing is, she's been inspired to do this because she really wants to help people. And we have these conversations all the time over the dinner table about new things, new products, new things in medicine. And we thought we'd bring that format to you because I think it's a little bit more entertaining, a little bit easier to have this sort of format when we're wanting to talk about new things. With that, Katie, take it away. What's your first question?
Talking about this very important topic, let's get back to basics and discuss what is a peptide generally.
Well, generally, a peptide is a short chain of amino acids. So basically, amino acids are the building blocks of proteins, but shorter proteins are called peptides. And so these proteins are, and to distinguish a little bit, there are peptides that our body actually makes and that we can mimic, and those are not considered medicines or drugs. And there are peptides that are mimic the body's own peptides, but maybe with some alternate changes. And that's when the FDA steps in and has to approve it as a medication. And so what we're basically going to focus on today is more naturally occurring peptides, which are actually made copies of the protein sequences that the body uses to make these peptides. And they are not controlled by the FDA, not necessarily approved by the FDA, but not controlled by the FDA.
What makes these medications or naturally occurring substances in the body, like what makes these the wonder drugs, whether or not it's a patented drug? What makes it beneficial? What makes it life-changing? Let's get more into other peptides and what their uses could be and how they can help.
Let's keep in mind that most of these are still, they're not approved by the FDA, they're not down by the FDA, but they are considered research-only products. And you'll see that term used a lot. And so basically, if you're using them, you're doing research on yourself. And it would be good for you to keep track of when you take, because this could be used in the future if you want to give that information over. It can be used as a database for how these are affecting your body, and can also be compiled if a group wanted to do that and said, hey, give us your information, then we could use that in the future to basically do like a study. That is one of the things that the companies that manufacture these and sell them use as a protective barrier. And so you will have to overcome that. Even if doctors are advising them and we're using them through compounding pharmacies, they're still considered a research product.
Right. And, pulling a bit of a Pedro here, like you should know this too. Generally, anytime you take anything for your health, for your wellness, whatever it is 100% always recommended by us and by any medical professional of any kind that you should be transparent about what you're taking and how much you are taking with your doctor, especially if you are on any other medications, because this leads into me asking about, taking this and considering your liver. So while they can be amazing and wonderful and have all these beneficial effects for your body, your body still has to process them, correct?
Correct. And some of those metabolisms are by the liver, some are unchanged through the kidneys. And so everything has an effect. The body makes things, makes signaling proteins, and then they get destroyed by the body and taken away. And that's where we talk about half-lives. And a half-life means that the amount of that you put into your body, the half-life is when it's cut in half. So if it's a 2-hour half-life, in 2 hours, half of that drug will be gone. In the next 2 hours, half again. And so that's important to understand when you're using these peptides. It's important to understand how long they stay in the body and what their function is, and to be familiar with some of the side effects they may have and look for those side effects. Some of them may be minor and worth the juice is worth the squeeze,
Right.
and so, that's another aspect of these is some of the side effects are just that. They're just side effects. They're not dangerous in any way. For instance, nausea might be a side effect of some of the GLP-1s that we talked about. And if nausea keeps you from eating as much and that's a beneficial effect and you can tolerate it, then it's maybe a worthwhile effect.
Right. Like if your cholesterol is getting better, you're losing mass amounts of weight, your insulin response is better, you're not as insulin resistant, like those definitely outweigh health-wise being a little nauseous when you take the medication.
Right. So everything has its give and take, and those sorts of things are not dangerous to you.
Right. Exactly. So I want to get a bit more specific about your favorite peptides, what you tend to use, especially with your celebrity clientele. I know there's a lot that practically reverse aging, that help you look and feel younger, that help with hair growth, that help with skin tissue development. So you can have your skin look visibly younger, more of these aesthetic peptides as well, or the peptides that you're more familiar with that help you on a cellular level.
First, one of the most well-known, well-established, well-tested is BPC 157. Stands for Body Protective Compound. It's made by the stomach, and it's what keeps the stomach in balance. In other words, your acid is breaking down the cellular structure of your stomach, and it actually helps you to regrow, rebuild, heal as fast or faster than the acid can break it down. And so it is a super healer. And we've used that a lot in the body for tendons and ligaments improvement. A lot of people that want to work out and recover faster, it helps with that faster recovery. For in the gut, there's an oral form. It has a different protein ending or a different amino acid ending, which allows it to withstand the gut better. And so the oral forms of BPC help with Crohn's disease. They help with ulcerative colitis. They help with IBS, irritable bowel syndrome, and they help to heal ulcers. And so it's really great for just some general medical conditions in the oral form, but in the injectable form, it works the best when injected near or around those tendons that are injured and may need healing. And it does have it's considered staying in the body for about 6 hours. And so it's not a super long half-life. And so that one can be used almost daily for different effects in the body. And even the injectable form injected near a tendon is going to get some systemic absorption, and it may help the stomach and other things that are going on in the gut as well. So it's been very useful in my practice for people that have gut issues and really helping heal the gut. And then if you want to consider the quote Wolverine combination, that is combined with TB500. And TB500 creates a lot of angiogenesis. That means blood vessel growth. And so anything that has better blood supply heals faster, heals better. And so in combination, they're considered the great healer. And so that good healing potential again, can be injected, but it's considered to have a much longer half-life, like almost 24 hours. So it can stay in the body for an entire week. And so you don't necessarily need to inject that every single day. That could be once or even twice a week. If you want to kind of keep it more even in the body, usually more twice a week. And in a larger quantity, because then you don't have to keep injecting yourself every day with it. And so, and that's available also in an oral form. You can take them together. A lot of the products that are out there available on some of the peptide websites are combination products of the two. I've kind of thought that was a little bit, people like to take things together. They like simplicity, but one's shorter acting, one's longer acting. You'd be better off having them separate and using them for their separate advantages. Another couple of my favorite peptides are the growth hormone releasing peptides. CJC 1295 and Ipamorelin. Ipamorelin works more on the ghrelin system, causing a faster release of growth hormone. And the CJC is more of a prolonged, acts like growth hormone releasing hormone, something the brain produces to stimulate the pituitary to make more growth hormone. And growth hormones are really good. They fade a lot as we get older, and they're really good for improving health. So building muscle mass, losing fat, cholesterol ratios, and also the turgidity of the skin, the thickness of the skin, something we notice like when someone gets older, they call it crepey skin.
Right.
It helps with the density of the skin and just the overall appearance of wellness and youthfulness, actually. And so in combination with balancing your hormones and by the way, hormones are peptides, estrogen, testosterone, they're peptides as well. And so in combination with keeping your hormones balanced and healthy as you get older, that's a good way, besides actually taking growth hormone, which is much more expensive. Taking peptides can stimulate your own body to produce more growth hormone, which is important as we age to maintain the integrity of our cellular structures.
Right. And from what I understand, that's also what makes peptides excellent for fertility if you're trying to balance hormones to get pregnant and you want to have that fertility and not compromise your health and how you feel while being fertile. So I think it's kind of a leap forward in the right direction as far as if somebody wants to have children, but they feel like their testosterone's low, but supplementing testosterone can affect their fertility. All these things we're starting to learn about the human body progressing forward. And that's where peptides really strong arm themselves into the situation as the most beneficial treatment versus hormones.
Yes. And those are other topics that are great for the future, hormone balancing and the importance of hormones, and keeping those balanced both in the fertility years and the post-fertility years, because there are different protocols for those. And so the hormone balancing is another important aspect. That's actually where I started my journey, was with hormones. And then moving on to growth hormone and peptides and stem cells and all the benefits of all these things. Also, SARMs is a subject for another day, selective androgen receptor modulators, because they are very effective at increasing bone density and muscle structure. And that's important as we get older.
I think you'll agree with me on this one. When in doubt, find a doctor who knows about peptides and ask the questions you need to ask. Even if you do independent treatment for yourself, peptides are not supplements.
Right.
It's not as simple as taking vitamin D, and if you take a bit too much, I kind of feel queasy and got the burps. It is a stronger, more potent substance. So I would say that, and I know that you'll agree with me on this, get a doctor to start you off on a protocol and then check in with your doctor as far as side effects how it's going, what you're noticing as far as the positives or the negatives, and they can help you regulate dose, or maybe you do need to take it orally versus the injection that you were previously taking it as. So a doctor can help you differentiate that sort of method for what's best for you, not only dosage wise, but how it's administered.
Correct, because what you're treating matters on how you're administering it, either orally or injectable. And the other thing to keep in mind is there's a lot of information on these. There's becoming a lot of information on these on the internet, and they've honed down on a lot of the dosages, which seem to be pretty accurate, but they may not be accurate for you.
Right.
And so that's the important thing to consider is they may not be accurate for you, and there's a lot of winging it out there and saying, hey, a lot more is going to make a lot of difference. It's actually considered that if you're taking more than 500 micrograms, half a milligram of BPC at any one time, that there's not a tremendous amount of advantage and you're just kind of wasting it.
That reminds me, it's almost akin of the taking too many of a supplement term of like, that's expensive pee. Like if you're taking more than what you need, it's extra processing for your body and extra money out of your wallet. So if it's not necessary to take, you don't want to overkill it. More is not always better.
And anyone who's here watching and considering peptides, you've probably already done some research and you realize they are not cheap. And that is because they are manufactured sequences of amino acids. It's not a cheap process to put these together. And so if you're spending the money, let's not be wasteful.
Right. And that's another great topic right there. What are the red flags to look for when it comes to this peptide might be cut with a little something else? It might not be the dosage that it says or the potency that it says, or it might not be a real peptide altogether. What would you look for as far as sourcing that tells you, red flag, I don't think this is legitimate?
Well, it's hard because there's so many companies out there that are legitimate, and the only way to know is for someone to get out there, and I don't know if I've ever had the resources or wanted to make the resources available to independently test these products. I know there are people out there that have. Most of the companies say that they have a lab that does independent testing, and they'll give you certifications and everything like that. And most of them out there, I think, are trying to give you a good product and be accurate. But there's always someone who says, hey, look, I can sell people just some lyophilized nothing that's really cheap, and you're not getting a response from it. The only real way to guarantee that you're getting it is for a doctor to prescribe it using a compound pharmacy, and the compound pharmacies don't carry every little thing. They may, you can get some things through the pharmacy. You can probably get TB 500. You can probably get BPC 157 through a compounding pharmacy, and prescribed by a doctor. You're going to incur a significant, probably more expense going that direction, but you're going to have a little bit more security in your potency because or in the accuracy of your dosing.
Right.
And so even if something is cut with something else, it's usually not going to be dangerous to you. So you're not really risking your life when you're buying from one of these companies, but you may just not be getting the potency, and you may not be getting an accurate unless you actually have your product tested and have it sent to a third party lab to test it.
Exactly. And this is where it's very important when you are taking anything new, supplement, peptide, medication, that you are taking the time to be in tune with your body, checking in with how you feel, taking notes about if you up your dosage. Have you noticed any difference in side effects, more positive or more negative? These are all really important factors to consider. I feel like when it comes to people's health and wellness, there's often that gaslighting factor of having a super bad reaction to upping your dosage and saying, well, this happens when you up your dosage, or maybe it's just a side effect I have to take with the medication because I want the positive benefits. You have to weigh whether or not your experience is more beneficial than it is extreme or hurtful when it comes to the negative side effects. So documentation when it comes to any medication, supplement, or peptide that you're on is very important. When or what circumstance or what peptides might you need to adjust dosage as you are on the peptide?
Everybody is a little bit different. And so the way, the amount that it takes, and that's why we also have what we call a volume of distribution, the size of our body.
Right.
And so a lot of medications, because adults are similar size, then 2 tablets of 400 milligrams of ibuprofen is the same recommended over-the-counter dose for a 100-pound person and a 250-pound person. And so, the max dose, 800 milligrams every 8 hours, might not apply to someone who's 260 pounds, and maybe way too much for someone who's 100 pounds. And so, but most dosing that we've talked about is related to a regular adult human, but we are different sizes. So we can possibly take a little bit more. That's why there's ranges of dosing.
Okay. So to kind of take that and to put a nice little bow on it, there's a sweet spot that we're trying to hit.
Exactly.
And your sweet spot for peptides, as far as the particular one that you're taking, will usually consistently be your sweet spot.
Yes.
Okay. That's excellent. I've actually never heard that explained, and this is often it's funny because this is what makes me think of our dinner time conversations. Is I usually do learn things from you that I haven't heard before, or I will usually bring up a research paper or an article and ask your opinion about it that you might have not seen before. And I think that things like this are very important conversations to have. And they're not normally had between a patient and a doctor because they don't usually have 24-hour access to their medical professional. But I technically do have 24-hour access to my dad. So,
and also, doctors don't have 30 minutes to describe it to their patients. So,
right.
So we really are limited on our time that we can spend with patients. So using a format like this to disperse information is a good method to get it out. So I don't have to explain it on an individual basis over and over again, like so many of the things I do in my regular practice.
Okay, so one last burning question that I'm sure everybody is wondering. Does Dr. Williams have considerations of his own patient-accessible product line when it comes to peptides?
How did you know what I was thinking?
I just ask all the right questions at all the right time.
No, I do think that patients deserve to have a reliable source, a reliable way to get peptides that is consistent, well-tested. And I alluded earlier that I didn't want to put out the money to test other people's products themselves, but I definitely would put out the money to test my own products and make sure that they are independently tested and are reliable from a physician.
So if anyone's going to do it right, you're planning on doing it right.
Exactly.
Well, I know that we have had a lot of questions today, and you have taken the time to answer each one of them thoughtfully and with your expertise. And for that, I know the audience thanks you, but I also thank you for, as always, the stimulating, very scientific, very nerdy conversation.
Thank you for being here with me. I think this will become a more regular thing, not everything with me just boring and talking about things and looking at the camera. It's great to have some interaction, and it's great to have those questions that you think the general public would like to answer. Thank you, my audience, for joining. If you need any more information, you can go to our website, grantwilliamsmd.com, and that way you can either set up an appointment, talk to Katie, get some customized medical plan for yourself. In the future, look forward to a marketplace where we will be providing medical grade products for you and your family to get the security of knowing you're getting a product from a physician that is well tested. Stay safe, be well, and love your family and love yourself.
Is that okay? Do you think that was ultimate best take? Because there was a part where my brain farted and I fumbled. This is the one. Look at me right now. Put it in my head, put it in your head, put it in his head. That's your job.
Beam, 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 beam.
Say what is that?
No, I did it wrong. No. No. But we have enough of a pause where I can just say that last line again.
Okay.
That's the only thing we messed up on.
Well, let's go there. Do it.
All right.